Good morning everyone. My name is Tamara and I'm here today to discuss with you a relatively new technology. Some of you may already know of it or have heard about it, even possibly used it. It's called telehealth. Telehealth or telemedicine is, as defined by the World Health Organization, the use of telecommunications and virtual technology to deliver healthcare outside of traditional healthcare facilities. Today I want to discuss with you the importance of telehealth to us as nurses and how it benefits our skills development. I also want to share with you some research-based challenges you might face and the opportunities telehealth presents to healthcare as a whole. Telehealth continues to grow and is likely to continue to spread over coming years. Nursing practice, along with community health, can benefit from the utilisation of telehealth. With improvements in patient care and solutions, reduced cost in providing care, knowledge sharing and diffusion, reduction in travel for both patients and healthcare professionals, and of course improved patient satisfaction when using this method of holistic care. Offering telehealth allows healthcare professionals to expand their patient base to include patients who live far away from healthcare facilities and who wouldn't have otherwise been able to travel to their appointments. Telehealth can also help to improve the delivery of culturally appropriate healthcare to Indigenous Australians. In a recent study performed by Caffery, Bradford, Smith and Langbecker, it was revealed that primary healthcare services that utilised an Aboriginal community-controlled health service, operated by local Indigenous communities and providing telehealth as a service, displayed reduced barriers in access to healthcare and progressively improved health outcomes for Indigenous people. Some 49% of public hospitals and 14% of private hospitals in Australia are engaged in some form of telehealth activities according to Stanning, Garrigajan, Standing and Cripps. The Department of Health and Human Services estimates that more than 60% of all healthcare institutions and 40 to 50% of all hospitals currently use some form of telehealth. Telehealth facilities provide access to health services, support quality health care and more efficient resource management by addressing health inequities which may be related to being distant from more comprehensive health services. By integrating the use of telehealth into practice, nurses can expect to improve their technical proficiency and knowledge. However, this requires the nurse to be an open-minded, flexible and patient when dealing with complexities of telehealth. An increase in telehealth is an opportunity for nurses to be involved in this modality of providing care for their patients. As the largest professional group, nurses play an important role in ensuring the success of telehealth. The telehealth network helps provide nursing staff with access to various staff from multidisciplinary teams. Collaborative working and access to networks are seen to be delivering better solutions for patients and more appropriate training because they can draw on greater knowledge and expertise. This method for collaborative work also helps develop stronger relationships and trust between healthcare professions. With any new technology, we can expect challenges. The processes that are involved to develop a clinically meaningful telehealth resource that enhances the work practices are complex. This often involves a large number of stakeholders. A survey of 10,000 members of the Australian Nursing Federation found that most nurses' use of ICT was limited to basic computer applications, and their confidence in the use of technology was low. Tuxen Reid et al. Found that expanding technology holds the potential to improve the quality and reduce the cost of medical care. However, the evidence base for its use is currently limited. There is also minimal understanding about what in fact nurses need to be able to confidently and competently participate in the implementation of telehealth. As a result, research is needed to define the areas of medicine in which the application of telehealth technology does in fact improve health outcomes. Whilst conventional nursing knowledge and competencies for practice remain the same, The way in which nursing staff delivers care is different with telehealth. As such, additional knowledge and skills are required, and these often are underpinned by computer literacy. In order to promote and foster the benefits of telehealth, Honey and Wright state that having a sense of vision is considered an important attribute for a nurse to possess. Added to this, the nurse's readiness to learn and their individual characteristics also impact on learning about telehealth. According to the qualitative study performed by Collier, basic internet connection and IT was also a barrier to the service. It was found that nurses often felt personally and professionally responsible when internet connections failed and/or the video platform was unsuccessful in functioning correctly. Privacy concerns surrounding communication with individuals remotely also possesses a potential risk. There are concerns of the potential disclosure of protected health information with someone other than the intended recipient. However, telehealth offers a number of advantages to nursing too. Internationally, health services are stretched by the demands of ageing population, increasing expensive technology, the growing prevalence of chronic diseases, and high patient expectations. The clearest benefit of telehealth is the increased access to care by making examination, consultation, and education available via enhancements in user convenience. A transformation of the traditional "you come to us" healthcare model into "we'll come to you" approach. Telehealth visits can be performed in many types of locations, including rural hospitals, a patient's home, cruise ships, or even schools. Patients can save time and money, which makes telehealth very attractive to the time and money conscious patient. In situations such as post-operative visits, where the patient may be in pain and less mobile, being able to conduct their appointment remotely allows the patient to stay comfortable and in their own home. It is important to note there is no one-size-fits-all method of telehealth. The benefits and challenges of telehealth must be evaluated from the eyes of the patient, providers, caregivers, communities, and health systems. The future is likely to bring greater and more rapid technological advances. With 90% of the world population possessing smart technology, for example, smartphones, by the year 2020, the opportunities for academic health centres to expand their reach and changes to the nature of medical care is becoming a certainty. With that in mind, it needs to be remembered that telehealth is merely a tool, no different than a stethoscope, which follows the guidance of the one directing it. Not unlike our tools, telehealth is useless without a person to keep it aligned with what is needed most. To summarise, the benefits of the implementation of telehealth into nursing practice far outweigh those of the challenges this innovative technology presents. With the fast-paced growth of technology and its application throughout Australia and worldwide, telehealth is opening up avenues for nursing staff to be able to provide greater support to their patients, no matter how far away they might be or what socioeconomic background they come from. Nursing staff can use this tool to further their knowledge and create strong foundational support with multidisciplinary teams to improve their patients' health outcomes. Thank you again for your time today. I hope you've enjoyed learning about telehealth and what you can gain from utilising this amazing health innovation.